This is the Trying Again podcast, a story of miscarriage. I'm Rachel Smith. If you're listening to this for the first time, you may want to go back to episode 1 to get the full story, as some of this might not make any sense. The conversations in this episode will be frank.
It's so silenced and shunned away, the kind of physical side of it as well, that women feel, we're made to feel ashamed about having periods, for goodness sakes.
And they may be difficult, but they are needed.
Generally, it's that sudden loss of symptoms that we worry about.
Personally, and ironically, I try not to use the phrase trying again when Lee and I talk about trying again. I've said for years, the pressure that some couples put on themselves to try again, between ovulation apps, sex on specific dates, personal and family expectations, the waiting to see if you've caught, the disappointment when you don't, miscarriage and all the trauma and pain aside, thinking about trying again is stressful. It got me thinking also about how much I have changed as a person since my miscarriages. And that's what I want to discuss now. Our bodies. Us. As women, we have amazing bodies. No matter what the shape, we are made up of cell wonder. Even those of us who've experienced a loss or feel broken inside. I know I've felt broken, like my body isn't working properly, like I'm not really a woman. It's a cruel thing to think, and those thoughts are damaging. I know this, but I still feel it. So I thought this is something I need to explore a little. For those who've listened to episode 5, I'm going to take a similar approach, tackling this topic like an onion, seeing what layers I can take off. To help me unravel this topic, I'm joined on this episode by Julia Bueno.
I am a psychotherapist working in London, and I have a specialist interest in working with women and couples after pregnancy loss or struggling with their fertility.
Julia was a support worker for the Miscarriage Association and is the author of the book The Brink of Being. I'm also joined by Kate Marsh.
I'm the midwifery manager at Tommy's. I am a practicing midwife and a health visitor also.
Tommy's is a UK charity that funds research into miscarriage, stillbirth and premature birth and provides pregnancy health information to parents. I figured between us we can find some truth and answers.
The human body is a marvellous thing, but it also, during pregnancy, there's so many surprises and hormones can do all sorts to your body. So there are a lot of unexpected surprises. And, at Tommy's, we get a lot of emails of women being really unsure about their symptoms. Some people get really bad sickness, others don't get any at all. But actually, symptoms can vary hugely in early pregnancy. And for each pregnancy as well. So for some women in their first pregnancy, they might have had everything under the sun. And then the next pregnancy, the symptoms may not be the same at all, may be really reduced, not really recognisable at all. So it's really quite unpredictable. And looking at, a loss of symptoms, again, we get a lot of questions about one day my boobs are really sore and then the next day they weren't at all. And, when should I worry? And actually, generally, it's that sudden loss of symptoms that we worry about. And again, some spotting or bleeding in early pregnancy isn't uncommon. And a lot of the time it can be a sort of early implantation bleeding. So obviously that can look really worrying sometimes, but most of the time bleeding doesn't necessarily mean a loss, but we always say you need to get bleeding checked out if you have it at any stage in your pregnancy. So it can be quite an uncertain time and also have quite a big effect on your emotional well-being as well, and that isolation and not always talking to people can be quite difficult.
So when you're in those 12 weeks and things are starting to change, how are we expected to cope with that?
I think, for everybody it is different. Some people are more open, so they might have a chat with their friend, have a chat with their mum. People that have been pregnant before, is this normal? There's a lot of Googling that goes on, I think, and I would always suggest to women to try and go straight to websites that are evidence-based, like NHS, like Tommy's, because I think sometimes straight Googling can bring up a lot of, all sorts really. The internet is wonderful, but it's also terrifying sometimes.
A lot of fake news.
Yeah, that's it. So it's sort of going straight to a reputable website and having a look at the information. But actually, if you're ever in doubt, then it is important to be able to talk to somebody. It's better to do that than to sit at home worrying, because it can be a really anxious time.
One thing that I come across a lot and have done in all the years of practice, and unfortunately it has changed a bit, but it does still go on, is that I say to women to, trust their wisdom. When we know our bodies. And as you say, when there's a sort of sudden change, I speak to so many women who just say, I knew it. I knew that. And it might be whoever who might just say, no, it's nothing. I hear lots of stories of women and couples being, just not properly listened to. You're absolutely right. Don't sit at home and worry, but it might mean stamping your feet a bit and being a squeaky wheel and just to trust your hunch. That's such a common thread in the experiences I hear.
Yeah, no, absolutely. I 100% agree with you. And sometimes it's not easy to pick up the phone for whatever reason. As a midwife, if a woman says to me, I just really feel like something's not wrong, it really sends me goosebumpily because I'm like, oh goodness. Because I just think that is such a telling thing for a woman to say.
And the other thing, I'm so glad that you kind of mentioned about pregnancies being different. I mean, I had 5 pregnancies and every single one was very different. And again, if you're pregnant after a previous loss, and as you say, one pregnancy, you're yakking all the time, you're feeling terrible. It can be really, really nerve wracking if your second pregnancy doesn't follow that trajectory. And it's really reassuring to hear that, pregnancies can be different. So, just to know that it doesn't necessarily mean that that it's going to unfold unhappily, but of course don't get advice, but just also be aware that not every pregnancy is the same. I think that's a lot of people don't know that. They just expect them to map out the same way.
How would somebody like me go in and stamp my feet and be able to say stuff if I'm not too sure what's wrong?
That's okay. I think you don't need to know the jargon. You don't need to know the language. It's about finding a way to just say how you're feeling, and you can use whatever words you want, really, within reason. But it's how you express yourself. We're all humans. We all do that in a different way. That's human nature, and it doesn't matter if you don't know quite what words to use. Sometimes all it is I just really just don't feel like something's right. I'm really worried. I'm really concerned. And that can be enough. It doesn't matter that you don't know the language. It doesn't matter that you can't really put your finger on exactly what's wrong. As long as you are asking for that help. And the more that you can say, the better. But, it can be a really emotive time. And sometimes words can escape. If you're worried about going to an appointment, I always suggest either you can write down what you want to say before you go, because sometimes when you get in there, your mind can just go blank and it can be quite emotive and you don't feel like you've done yourself justice coming across. So sometimes it's easier to write down what you want to say. And again, or you can record it on your phone, whatever you'd rather do. And when you're there, write down what, the doctor or the nurse or the midwife is saying to you as well, because then it's quite easy to forget the conversation that you've had or what's been agreed or what's been said. So then you can come away and sort of reflect on it and have a look at it and see, am I happy with that care? Am I clear with that care plan as to what's going on? And don't worry if you're not clear or if you're a bit confused. Again, just call back or call the early pregnancy unit and just say, I just want to clarify, why this is happening. Because at the end of the day, it's your body, it's your care and it's your baby. So, as much as you're being an advocate for yourself as well, and care should be agreed and planned with you. It shouldn't be laid out and you told what to do. By the end of an appointment, you should feel happy with the care plan and really felt that you've had an informed discussion and understand what's going on. So in no way do you need to know the jargon. And if someone's speaking in jargon or say something that you don't understand, then just ask. Sometimes as a professional, we sort of witter away and kind of might not really realise that what we're saying isn't that clear. So just ask. And, as a professional, we should be able to communicate clearly and understandably for the people that we're supporting.
Just hearing Kate speak, and it's just wonderful sort of music to my ears to hear sort of to say that that jargon isn't recognizing it isn't helpful, and I think this whole emotive issue about language around pregnancy loss is due to the fact that when a woman becomes, steps through the kind of threshold of a hospital, she becomes, historically so, and I know care is changing enormously now, but historically so, she becomes a patient and she steps into a medical paradigm But of course, I've never spoken to a woman, a bereaved woman after a miscarriage who judges herself like that. That was a mum to be who is grieving her baby to be. So there's a sort of collision of cultures, if you like, of paradigms. And that's taken a while for medicine to catch up with. At least this is my experience as a therapist over the years and support worker, that women and couples have been really, really suffered a lot at the hands of that, not that language has hands, at the kind of impact of medicalized language around pregnancy loss. Now I know this is changing, and it's fantastic. It's sort of changed almost beyond recognition since my first pregnancy lost 18 years ago, but not everywhere, and it still does happen where kind of language slips out. And one very, very typical thing is that most couples, particularly if they've got a miscarriage, they have their scan at 12 weeks. That's their baby that they're looking forward to seeing, and that's their baby that they've been had in their mind for weeks and weeks and weeks. Maybe they've been trying to conceive for years, but they're much loved baby, and for it to be described as anything else in medicalized language, just a sort of a fetus or a blighted ovum or all these sort of medicalized terms that is really, really upsetting, and it really misses the experience.
I've spoken to women before who've had an early miscarriage, and I've made reference to the baby, and actually that didn't sit too well with them, because they wanted to kind of disassociate the fact that they were pregnant and it was potentially a baby, and then they passed that baby, and actually they didn't want me to use that term because they felt like it was, too personal, and actually they wanted to keep it quite matter of fact. So I think, if we get a lot of contacts of sort of friends or family saying, I know someone who's had a miscarriage, how can I support them? And I always suggest to use the language that the women are using and follow their lead. Then most of the time, hopefully, you can't go too far wrong, and you're just reflecting back to them what they're saying and using the same language that they want to use.
And the tricky one is, which I have met couples where each partner relates to the baby very differently. So the tuning in process has to be very nuanced if you're dealing with a couple.
Yeah, absolutely. Yeah.
How do you do that when if you're not one of the couple involved, you're a family or a friend? How do you even start that conversation?
The most important thing, if someone's looking to support someone who's been through miscarriage, is to really recognise what that women, those parents, what that family is going through. And it's better to say something to recognise what has happened than to try, and it become the elephant in the room. I think it's better to really just be open and honest. And even if you're not sure what to say, just say, I'm not sure what to say, but I recognise that this is really, difficult, sad time for you. How can I support you? And actually listening is just so important. I think sometimes it's that human nature to feel like you want to say something, or to feel like you need to make the situation better. And actually it's just important to be there for that person, to recognise what's happened, what they're going through. Again, use their language, and to listen and to be there for that person. And you don't necessarily need to say too much. You're not there to make it better. It's for that woman that needs that grieving process, and to go through what they need to go through to be able to kind of process and cope with what's happened and find their way. But as a friend or a family member or someone supporting someone, you're just there to support them and to hold their hand or give them a cup of tea or have a cry with them, and do simple things like that, just to let your friend know that you're there for them.
Two words that I use quite a lot is compassionate curiosity. Because in my experience, when people are kind of at home and they've assimilated the process a bit, they've got a few days or weeks down the line, and that can be a very kind of traumatic experience. Actually, people need to tell a story of the miscarriage, which always in my experience, nearly always begins way back. Maybe even when you met your partner and you decided to conceive. And the other thing that, and just with that kind of curiosity, that exactly as Kate says, just listening. But if you feel up for it, this isn't a prescription, but if you can, I think it's really helpful to ask questions, to be curious. Tell me about it, and what did it feel like, and what was your pregnancy like? And just as you would a pregnancy that ends in a live birth, women have been pregnant, and for a lot of people feel that they kind of share that rite of passage, but people don't ask the questions of pregnancies that end up in loss that they would with pregnancies that end up in live birth. And a lot of women just like to share that. People also quite often want to, not always, but a lot of women want to talk about the kind of visceral aspects of the loss and the birthing that they went through, whether it's even with an early miscarriage or a late miscarriage. They do need to talk through that trauma. And not everybody wants to hear that or ask about that. I don't want to hear about certain sort of things, things that make me uncomfortable. But if you do have the comfort and the courage to sit with your friend and say, tell me about the bleeding, tell me about the pain, how long did it go on for? I think a lot of people would really welcome that, because it's so silenced and shunned away, the kind of physical side of it as well, that women feel, we're made to feel ashamed about having periods, for goodness sake. So if you can, I would really encourage you to let them speak all the details.
And I think also kind of going on from that as well is particularly thinking about those who've maybe experienced a late miscarriage. A lot of what we talk about obviously is about early miscarriage, but for those who experience maybe a later miscarriage or a stillborn baby, it's also asking about the baby, asking the baby's name, asking the gender, what did the baby look like, as well is really important. So definitely if you're supporting someone who is later on kind of getting onto the second half of the pregnancy, it is to talk about the baby, because that woman is a mum and they want their baby to be remembered as their child, as their baby, and so it's having those conversations, definitely.
I write about this in my book. My first loss was a twin pregnancy that I lost at 22 weeks. And absolutely, I think to have one person ask me, can I see the photos of your baby? I think that would have made an absolute categorical difference to my grief. And for someone, exactly as Kate just said, to take a real interest in, I went through birth, and that doesn't, and actually some women, even earlier gestations, I'm sure you know that too, Kate, that they will go through a very, very painful and long birthing process for even an early loss, and might even hold their tiny baby who's not so developed in their hand. And again, if you feel comfortable enough to ask about that, I think that would be just so supportive and so warming, because that woman will have that baby in her mind's eye for the rest of her life. To be able to share that, but we tend to sort of, I think we've been socialized to be fearful of this and to shy away from this.
There's some things that you've touched on which I do want to go into a bit more, and it is grim. But one thing I did want to ask is, how much blood is too much blood, and when should I worry in that situation?
I think that, bleeding is always quite scary. We're not used to seeing blood, and when we see blood, it is quite worrying for most people. And everybody copes physically with blood loss differently. So it's about, you ask sort of how much is too much. So essentially, if you are soaking through pads and you're having to change that hourly to hourly and soaking through pads, then you need to be telling somebody. Alternative, you may not be really soaking pads, but it still affects you. If you've got a low iron level or low HB in your bloods, then you can lose less blood, but it actually affects you more. So if you're starting to feel dizzy, you feel tired, or breathless, then you need to be telling somebody. So you need to be looking at sort of how you're feeling generally. But if you are soaking through pads, or you're sat in the seat and after an hour you've got a thick pad on and you're leaking, particularly after a few days, then you need to be speaking to someone. The first few days, there is often quite a lot of blood, depending on at what stage you had your loss and what's happened. But if you've been discharged home, or you are at home and you're soaking through pads hourly, particularly if you start to feel dizzy, unwell, then you need to be telling somebody.
When you do see the blood, what colour is a miscarriage, would you say?
So the most obvious is obviously that fresh red bleeding. You might have some clots as well. That's the most obvious kind of bright colour blood. Now, some people might have what we call a missed miscarriage, so it might be that the baby's died, but then unfortunately that woman has not found that news until maybe they've had a scan a few weeks later, and you might get some brown spotting, a small kind of lead up to more blood. If a very early, what we call like a chemical pregnancy or early pregnancy, it might look more like a heavy period. So some people, if you have you may have found out that you're pregnant and then a day or so later had what you feel was a heavy pregnancy that we would call a chemical pregnancy, and that would look like a kind of a heavy period. But at most of the time that you will get fresh red bleeding. And again, some clots. And then if you're getting on towards the sort of second half of the first trimester, or going into the second trimester, then you will pass your baby. You will see large clots, and you will see, pregnancy tissue. You may not recognise the tissue as looking like a baby if it's kind of earlier on, but you will see those clots and larger pieces that you do pass.
Yeah, I mean, actually interesting. I was just remembering that my 16-week miscarriage, I had no blood at all until after the baby was passed, which is very, very odd. I don't know, is it, Kate?
No, I think during the second trimester, it is different. I think the bleeding is more associated with early miscarriages, and that's an obvious sign. But yeah, in the second trimester, you go through labour and you might deliver your baby and then have some blood afterwards. Yeah. Right.
Okay. Well, see that. Yeah. And of course, the other thing I know we're going to come on to, but with my later miscarriages, well, after my first miscarriage, I did have wonderful support, but unfortunately the kind of aftercare was non-existent, and nobody told me that my milk would come in. So I literally had no idea at all what was happening to my body, but of course, I just was suddenly full of milk. And without any kind of warning, that was a really distressing thing to go to.
I just feel like every time I've had a pregnancy, they just get bigger and then they just stay. But where does the milk go?
Dries out, doesn't it?
Yeah, absolutely. So, some women will leak. And if you are leaking, then don't encourage the supply. So don't try and sort of squeeze it out in any way, because it will then encourage your body to make more. So, if you do notice that you are producing breast milk, do have a chat with a healthcare professional, because there is medication that you can take to stop the production of milk.
I write about in my book actually of a couple who go through a late loss, and when her milk comes in, she decides to pump and to keep her milk going, and actually she's not alone, because I know of other women who've done this, and for some women that it depends on the milk bank that you might be able to donate after loss, and that does happen after women have stillbirth or kind of a late loss. And for the woman that I wrote about, it was actually really just a really important part of her mourning, to keep a link with her baby going for a while. And she just pumped for a couple of months, and she kept the milk and froze it, and then when at a later stage she sort of performed a ritual with it, with the ashes of her baby. So when I had my milk come in, I poked my boobs because they were so painful. Of course, I had no idea that I was actually making more milk of doing it, and until my husband kind of called up and he bound my breast to make the milk go away, and so that kind of problem went away. But I'll never know, because it happened 18 years ago. But if someone had told me, you know what, if you want to keep the milk going and pump it, I might well have taken that offer up. I would have, taken that advice up, because it, as I say, for this woman I wrote about, it provided a really valuable link. But also it's, and this is very, very personal to me, so I own this as my own story. But when you have a pregnancy loss, most women I talk to feel a tremendous failure, whether you like it or not. You can have 100 people telling you you've done nothing wrong, but it just happens. And I certainly was one of those women. I thought my body had really failed me. But when my milk came in, there was a bit of me thinking that my body hasn't failed. It's, it can produce milk.
Yeah, no, that's really interesting. And I think, communicating with the local milk bank if you want to donate it, that you're absolutely right. Some women find that quite therapeutic and quite a helpful thing to do in their grieving process. But yeah, no, it definitely really interesting point.
After a miscarriage, when the baby's not there anymore, how do you get your figure back to a place where you're not seeing a empty bump?
It can take a little bit of time. Obviously, if it was earlier on and the bump was smaller, it happens quicker. If it's later on, then it can take time. With regards to exercises or food or diet or anything like that, I would just be careful. When it comes to exercise, that your body produces a hormone, which means your ligaments are a bit softer and stretchier in pregnancy, and so it can take time for that to go down to a pre-pregnancy level. So if you were to start exercising that time and that hormone level is still a bit raised, then you just need to give your body physically a little bit of a break and not to push yourself too much. It also depends on what you were doing before pregnancy as well. If you were very fit, you were a bit of a gym bunny, you ran marathons, then getting back into exercise would feel really natural for somebody. I think it's about knowing yourself, knowing your body, listening to your body.
What I do know is that, going back to this point about it being incredibly common for women to feel a tremendous sort of dip in self-worth and a sense of guilt and blame and failure. These are really, really commonly held feelings and experiences that can become a kind of filter through which we experience our embodiment and ourselves in the world. So what I'm saying in a roundabout way is that we can feel that our body is sort of uglier, or you don't like your body as much. You're not saying that, Rachel, but that quite often happens. But that can often be just part and parcel of the kind of emotional fallout, really. Of course, bodies do change. I'm not challenging that, but I'm just saying, being really extra kind to yourself and just let yourself off the hook a bit and realize that you're likely to be being quite tough on yourself, full stop, including your body. Women often sort of say that to me anyway, that they kind of don't even want to look in the mirror.
Yeah.
So yeah, of course the body does change, but there is that sort of psychological piece that needs a bit of compassion for too.
So then that's going to lead me on to a question: when can you have sex after miscarriage, and especially if you are in this place of not particularly maybe liking what your body's done to you?
Yeah, I think sort of talking, scientifically or medically, or what symptoms, essentially we say that, waiting until your bleeding has stopped, because if you're having intercourse whilst you're still bleeding, then there is a risk of infection. So we would suggest to wait until that bleeding has stopped. And for some women, after their bleeding has stopped, they still get some ongoing kind of heavy discharge as well. So I would just suggest to wait until that has settled down, which means that, everything has closed, the cervix is completely closed, and uterus is contracted back down, and so that really then the risk of infection has come down once that's happened. So when the bleeding has stopped really, and you're not in any pain, and you feel physically ready to have sex, then that's when, from that point of view, that you can go for it and have sex. What I would say is that it is possible to conceive or become pregnant again before you experience your first period. For some women, that's what they want to happen if they have a miscarriage. From a kind of medical point of view, also thinking about contraception, or being aware that pregnancy can happen before a period happens again.
There's a difference here, isn't there, between kind of having sex and trying to conceive again. And actually quite interesting that, in my day, the advice has changed. When I had my first miscarriage, I was told to wait, at least 3 months before trying again. And whereas now the advice is very much sort of crack on when you feel comfortable and the bleeding has stopped. And it's just really, really, I think, so important for you to decide when it's right. Because one thing that also is very common, that there are so many kind of myths and taboos around miscarriage, but what quite often happens is that couples are encouraged to just crack on and get pregnant as soon as possible. I certainly went through that. until I had my fourth miscarriage, and everybody thought I was deranged to want to try again. And I don't know whether you've had that, Rachel, but quite a lot of people there's this sort of cultural swell to sort of hurry up a bit, because you're not allowed to grieve, and you're not allowed to take your time grieving because it's not a proper grief, etc. And I would just sort of flag that up as you've got to find the time is right for you. Quite often I find myself sort of supporting people to think, are you really sure you're ready? And sometimes they're not. I'm guessing the kind of the medical advice, Kate, would be different if you've had an ectopic pregnancy or a late pregnancy or a molar pregnancy.
Yeah, no, absolutely. I think if you've had medication, for example, if you've had an ectopic pregnancy, then yeah, they do suggest that you wait several months before trying again. Again, with a molar pregnancy, then you may need to wait till some test results come back and give you the all clear before trying again. So yeah, no, sorry, that advice was kind of for an early miscarriage. But yeah, if you've had any other type of loss, then I would seek guidance from the doctors or the healthcare professionals who are looking after you, just to see what the advice is about trying again.
So if we're in this place of like, it is fluid, and for early pregnancy, obviously for when you've got tests and studies, you'll be with the health professionals to advise in case by case. But when you're in that kind of world, when you haven't had the 3 in a row that you have to have at the moment, when would you know a miscarriage is complete? What does that feel like?
Sometimes it's not always obvious, to be honest with you. Generally, the early pregnancy unit will advise a woman to take a pregnancy test a couple of weeks after the bleeding has started. And if that pregnancy test comes back as negative, that means that the pregnancy hormone levels, the HCG level, has come down to pre-pregnancy level. Now, if that hormone level, or the HCG level, is still raised and ongoing, it can, not always, but it can indicate that the part of the pregnancy or part of the baby is still inside the uterus. If it's a little bit, sometimes a woman may pass that with her period. So if her hormone levels come down enough that her period and her cycle starts up again, then it might just be that woman experiences a slightly heavier period, the first one after she has her miscarriage. Unfortunately, for some women, they may have their miscarriage, but part of the pregnancy, part of the baby, part of the tissue is left behind. It then comes down to choice. Some women feel that they want that removed straight away, and either you can try a medical route, which is taking medication to try and pass the pregnancy. If not, then it might be surgery, so like a DNC, which is basically to take that part of the pregnancy out of the woman's body. Others may just leave it a little bit longer and want to see if their body passes it sort of naturally. And so long as there's no signs of infection, so for example, no raised temperature, no ongoing pain, the woman feels well, physically well, not feeling dizzy or lightheaded or feeling unwell, then you can actually leave that to go on for quite a while. But on the emotional side of that, some women find that that they don't want that medical intervention, and others just want it physically over as soon as possible so that they can start grieving. So again, it's quite personal as to how that's managed.
What's the thing that you most wish that people knew that you see?
I would want most women to know is, unfortunately, miscarriage is common. Unfortunately, about 1 in 4 pregnancies do end in loss, and it's not the fault of the women. It's most miscarriages happen due to the baby not quite developing properly from the moment of conception. We also don't know why a lot of miscarriages happen, and to not feel alone, because you will know someone else who's experienced a miscarriage. Even though they haven't said it, there will be someone around you that will have too. So don't feel alone. There is help, there is support, and do reach out as much as you feel comfortably to do so.
And go back to where we started, it might mean being a squeaky wheel and not taking no for an answer. And I would reiterate the point about our wisdom of our bodies. We've got it, and that should lead the way.
The difficulty of exploring our bodies and miscarriage is that I can end up down rabbit holes I don't need to be down. There's a thought I've had surrounding this topic of bodies, our bodies as species of human. I was watching a David Attenborough programme about biodiversity the other day. You might have seen it. During the show, the discussions moved on to historic changes to the environment that, according to professionals, could be to blame for infertility in killer whales off the west coast of Scotland. Now, this got me thinking about us as a species. If it's 1 in 4 pregnancies that end in loss, are there bigger issues at hand? And should I be trying for a baby if nature is telling me no? Is that just being selfish? When there are children in need of loving homes and environmental issues of humans overpopulation, does it make me a bad person to want to add a child to this already increasing numbers of humans on this earth? If our bodies are made up of our environment, and if there's historic reasons for infertility in killer whales, could this be the same for me? Is that why my womb doesn't work? I find that when I'm down paths like this, I need to stop and just turn right back around. Some of these thoughts are not helpful, and if left too long, they may be damaging my mental health. This episode was recorded and produced by me in my duvet den. The music is Small Bump by Ed Sheeran. Thank you to Julia Bueno and Kate Marsh from Tommy's for joining me on this episode. If you're going through it right now and you need some support, there's links to help available on the website tryingagainpodcast.com. If you've liked this episode, please share it and leave a review on your podcast app so that others can find it. And if you haven't already, remember to subscribe to this podcast so that you don't miss an episode.
You can wrap your fingers